I want to direct some questions about housing first to Miss Calder and to Miss Yentl. And I want to sort of introduce this by, when I was a kid, we had a neighbor move in next door to us, actually, and I live with my grandmother. And, she was a particularly troubled person, suffered with some serious substance abuse problems. And I remember one case in particular where she called the landlord, who was actually a family friend of ours, because before she moved in, this person lived there, and said, I've got a leaky ceiling problem. And the guy showed up and investigated, and the woman had passed out. She was on drugs on the bottom floor, and on the top floor, she had set a bath to run. And what had caused the leaky ceiling and, in fact, destroy the entire upper level of the house was that she had set a bath and then gotten high and passed out. And I think it illustrates a particular problem with some of the approaches that we've taken to homelessness and housing, where we tend to want to address so-called housing first without addressing the root causes of homelessness. And I worry about this in this particular context because whether it's in our urban communities or in our rural communities, if we don't treat the root cause of homelessness, we end up creating cycles of despair where even when you get women like this into a good home, ultimately it can be very destructive and not ultimately solve the very problem that we're trying to solve. So I guess the very first question I ask first to Ms. Calder is, do you think that we should allow people who have serious substance abuse problems, should we be giving them housing without any preconditions on substance abuse counseling, therapy, and so forth?
Look, I think that the homeless population is a diverse population. And
Sure.
so from my perspective, it doesn't make sense to have a one-size-fits-all policy. I think housing first is, it's an idea that has been adopted pretty rigidly in places like California. There are complaints in California from shelters that are, women and children shelters only, and they say, look, we can't get any state funding for our homeless efforts here, but we're doing a really important job here. We need to, have rules around substance use, and the reason for that is that these women that come into this shelter, a lot of times they're fighting for custody. They want to secure custody of their kids, and it's hard to do that in an environment where people are using substances. So I think that there should be, I think we should let all different types of homeless approaches, bloom and have a lot of diversity in that regard. And I think that unfortunately Housing First has been adopted in some places and that diversity has been sort of squelched.
Yeah, I just want to build on that before turning to you, Ms. Yentl. So as I understand it, the problem with Housing First is precisely the one-fits-all approach. In other words, you can take housing programs that are attempting to treat the root cause of homelessness, but then you're denying them federal funds if they're not following the so-called Housing First approach. And I guess, Ms. Yentl, I just asked directly, do you agree with that approach? And I'd love to hear why or why not.
Yeah, thank you for the question, Senator Vance. First, the root cause of homelessness, the one thing that all people experiencing homelessness have in common is lack of access to a decent, stable, affordable home. And the research and the evidence are very clear that if people have substance abuse challenges or mental illness, they are best able to address those challenges from a stable home. So low barrier housing first approaches that get people into affordable, stable homes and then provide them with voluntary supportive services as necessary is shown again and again in the research and the evidence to be the most effective way to address homelessness. And there are a number of examples in your state of Ohio, very successful Housing First programs that work with people experiencing homelessness who don't have substance abuse or mental health challenges, and those who do. And in both cases, it's the Housing First approach, that low barrier approach to getting somebody stably housed first, that works. We tried sobriety requirements back in the 80s and the 90s. As a country, that was our approach to addressing homelessness. We had a stair-step model where people had to prove that they were so-called housing ready. It didn't work, and it was overly expensive.
So let me just a couple points on that, Ms. Yentl. So first of all, it's interesting to contrast the 80s and 90s with where we are today, because while we've been trying a housing first based approach for the past few years in this country, as I understand it, we're spending about 200% more on providing homes to the homeless, 200% more on homeless support than we were when we weren't trying housing first. And yet, simultaneously, the homeless population in the country has gone up 20%. So it strikes me as a very bad deal for the American taxpayer, but more importantly for the homeless, if we're spending twice as much or more, and yet we've seen the homeless problem get worse in this country. I think a related point, I know I'm short on time here, so I'll yield after just making this point, is I really worry about the social contagion effect on this, because it's not, of course, just the homeless people themselves who are affected, but it's the people they share a neighborhood or people they share a building complex with. And I really worry that what Housing First has done is taken a lot of people who are very much struggling and very much deserving of our compassion, though I think how we provide that compassion is up for debate. But it also introduces people with serious drug problems, serious mental illness problems into communities with kids who are already in a very unstable situation, and now they're having things like drug use normalized around them. And that's certainly what you see in some of the neighborhoods where you have people moving in who are struggling in very significant ways. Sometimes those behaviors can become normalized to the kids around them. And I worry about that. And I worry that the Housing First approach is focusing just on the homeless population and failing, by the way, but also it's ignoring a lot of the kids who are affected by this Housing First approach. Again, if Housing First is working, why isn't it working? The homeless problem is getting worse.
Sure.
Time to answer that?
Go on, Ms. Yantel. Yeah, that's fine. Go on, Ms. Yantel.
So again, with respect, and the evidence and the data are so clear that Housing First does work. We know, and it works in your state of Ohio. We know how to end homelessness. And in fact, individuals have their homelessness ended every day in Ohio and throughout the country. What we can't do is stem the tide of people newly falling into homelessness as rents increase much faster than incomes do. And to the point of mental illness and substance abuse and contagion, I would just say that there are many people who are safely housed who suffer from mental illness and substance abuse. And I think we don't hear the same concerns about contagion raised there. It's because their substance abuse isn't as public because they have the ability to close their door at night and get the services and resources that they need while they're housed. I would love to also just note that there are many different types of people experiencing homelessness. And actually, the majority of people who do experience homelessness are working households or households who have struggled with being able to make ends meet as rents skyrocket and the cost of their incomes does not meet the increased rent as well. So there's a lot. I would love to have a follow-up conversation with you and to introduce you to some of the Housing First providers in Ohio who could share with you their success with the program.
Thanks, Senator Vance. Thank you, Ms. Yantel.